I'm Dylan Black, joining us right now from the Leaf Weight Management Clinic. Dr. Judy Shiau is joining us, and it's nice to have you here.
Thank you very much.
All right, so give us a bit of a history lesson on the Weight Leaf Management Clinic.
Well, we're into our third year, heading into our fourth, actually. We're in the Loblaws at the Gloucester Mall, and we're a community bariatric site with a multidisciplinary team, 2 dietitians, 8 physicians, social worker, kinesiologist. The whole works.
Busy team.
Yes.
Okay, so I love it on your website as well. So the quote, "Your journey to a healthier weight starts here."
Correct.
Simple as that.
Yeah.
Now, what is the issue? Okay, Canadians there's bias, there's discrimination. Canadians that are suffering from weight issues.
Yes, they're suffering from weight issues. And the great thing about the 21st century is now obesity is recognized as a chronic disease, just like diabetes is, just like hypertension. And with that, it takes away the shame and blame from patients, but there's still that stigma out there. And our mission, I'm part of Obesity Canada and the Canadian Association of Bariatric Physicians and Surgeons, and teach the medical students and residents at the university that this is a disease that we need to take seriously.
Okay, so it is a disease, so it should be treated as a disease. So what exactly would your clinic do to help out?
Well, if you look at the pyramid of different options for weight management, there's always the basic lifestyle skill sets that someone needs to practice. And so we do focus on that with our different programs. On the spectrum of treatment options for weight management, you have the potential for bariatric surgery, and then you have the layering of other options like meal replacements and medications.
Okay, there's a bit of an elephant in the room here because there's something sitting here in front of
Yes,
me, and it
yes.
kind of looks sort of,
I know,
what exactly
it looks kind of ick, doesn't it? But
Yeah.
so our clinic isn't focused on necessarily hitting a number. We're for weight management. That's what
Okay.
makes us different from other clinics. We're not about weight loss necessarily, but ultimately that becomes part of the process.
Yeah.
But sometimes I'll have a patient come in and they're so disappointed with the amount that they might have lost, and we'll be like, well, let's look at this. And so what I'll have you do is take, you can actually pick it up. It's not gross or anything.
Do you want me to pick it up?
Yeah,
Okay,
you can pick it up.
So can you tell me what it is first?
Oh, this is supposed to be a
Before I
sample
touch
of
it?
a fat mass.
Sample as in it's not an actual?
It's not a true fat mass.
Okay, all right. You want me to just
It's
pick this up
plastic.
and I'll pick this up?
But it's quite realistic.
Okay.
And then just try to weigh it in your hands as to how much you think that might weigh.
I'm gonna go 10 pounds.
So this is a 5-pound
It's 5 pounds.
fat mass, yeah.
Wow.
And I have some patients who are disappointed with a 5-pound fat mass rate reduction, but in reality it's amazing because that was actually all in their abdominal visceral adiposity, and that's the things that create the complications from weight, which is diabetes and high blood pressure and cholesterol problems.
All the bad stuff.
Yeah.
Okay, so you actually have a new treatment option that actually works with the brain. So how does this work?
So we were talking about the layers of therapy. So beyond lifestyle skill sets, we can add on other layers, and there's a role for medications. And there's actually 3 approved medications in Canada for weight management. There's one that's been around for a good 20 years. It's known as a fat blocker. There's another one that's in existence now that's an injection that helps with hunger management. And the newer kid on the block is a combination of 2 medications that helps with the cravings that people might have from weight.
Okay.
And so the nice thing about these options is that they can help the behaviors that people need to do in order to manage their weight.
Okay. 90% of Canadians don't have plans that would cover
It's terrible. It's
this, and obviously, I mean, you're saying it's a disease, so this should be covered.
Correct. And
Yeah.
you know, diabetes management, hypertension management, no issues at all. But they're the complications of obesity. So why don't we have coverage for these medications? Why don't we have coverage for dietitian services? Those are the people that can help with weight management because they're the experts.
So what can be done about this?
We need people to basically go up to the government and go up to their insurance companies and say something to the human resource.
Okay.
Yeah.
Another percentage, throwing numbers at you, 30% of Canadians who suffer from weight issues feel that there is no help out there?
Absolutely. And you know why? Because they think it's their fault. And that shame and blame continues to exist. And the simplest thing they can do is go to their primary care provider and say, I need help. And if their primary care provider doesn't have the time or the staff to help with weight, then have them referred to a reliable site.
Okay. There must be different plans for different people as well, because
Absolutely.
Where does it begin when somebody says they have weight issues?
So whenever somebody is referred into our clinic, we're there to hear their story. Okay? There is no one treatment option for one for everybody. Everybody has to be individualized, and that's the important concept with weight management.
Okay. And when you talk about treatment options, I mean, how long, I guess it does also cater to the person. How long
Absolutely.
they would have to come see you, the continuous treatments, weekly basis, monthly basis?
That's why LEAF opened, because we want to see our patients forever.
Yeah.
This is a forever disease, and they need help long term, even if it's just for that check-in for like once a year. But I let people kind of titrate how often they feel they need to come in, because they know themselves the best.
Because sometimes people do lose the weight, but then they will regain it because they don't have the help of professionals along the way.
Yeah.
So they need to come and see you. I imagine all this information is found at leafwmc.com.
It is.
Thank you very much, Doctor, for
Thank
being
you
here
very
today.
much.
Appreciate your time. All right, we've got much more daytime coming up in moments. I'm Dylan Black. You're watching Cable 22. It's Rogers Television.